right. Hello, everybody, and thanks for joining us today. I'm Erik Krucker. I'm the CTO at Comport Consulting. And today we're going to be talking about cybersecurity in healthcare and some of the challenges that healthcare organizations are challenged with or looking at today, and what they can do about it. Some practical steps as to how they can protect themselves, and what they can do to keep their names out of the newspapers or off the internet as far as being hit by a cyber attack. So with us today is Jim Cavanaugh. He's the owner and principal consultant at Executive Healthcare Consulting. Jim, welcome. Thanks for joining us.
Thank you, Erik. It's good to be here.
Yeah, thanks. As I said, we're going to talk about some cybersecurity items today, and what the challenges have been as far as cyber attacks and how organizations can protect themselves. So maybe Jim, introduce yourself, and we'll go from there.
Sounds good. So I'm Jim Cavanaugh. I've been in healthcare really my entire career. I've worked at hospitals. I was CIO at St. Joseph's Hospital in Patterson for 12 years. And about 8 years ago, I started my own consulting company. I thought I'd be doing a lot of work for hospitals, and actually I'm doing a lot of work in the space of interoperability, HIEs, public health, and a lot around security and HIPAA. I teach a class at Rutgers University, and just happy to be here and share some of my experience with you.
Yeah, thank you again. I really appreciate it. And I'm sure some of your insight, and the years you've spent in healthcare is really going to be invaluable here. So Jim, maybe you could talk to us about how cybersecurity and security in general has changed for healthcare in the last 20 plus years or so. It seems to me that cybersecurity, security in general, really, if there was issues, it was really more of a technical problem. Now it really is more of a business problem because of the impact that it has on businesses. So maybe you could talk to us about your views and how security and cybersecurity has changed over the years.
Sure, Erik, you're right. It has changed tremendously, and I think to some degree we all get a little bit tired of constantly talking about cybersecurity and risks and ransomware. But in reality, it's the largest problem that we're facing from a security and a technology perspective. At any time, you run the risk of basically getting shut down. And with all the critical need for IT today, it's the last thing any organization needs. We've seen it go from a kind of a hobby where people were hacking for the sake of hacking to a tremendously successful business where billions of dollars are being made from ransom and from attacks. And you combine that with the political nature of cyber attacks from nation states, and it has become something else. So it's a critical issue. It seems to be getting worse over time as there are more and more successful attacks that are resulting in the payment of ransoms and other costs. So we don't see it going away anytime soon. So yeah, it's a growing problem and continues to be getting worse over time.
Yeah, ransomware, although I think a lot of people are definitely tired of talking about it, it continues to be the number one issue because, as you said, it's become a successful business for a lot of people who are looking to do harm to organizations. One of the questions, and maybe you could chime in or give me your opinion on this. One of the questions that I've asked out on the internet is, would ransomware even be a thing if it wasn't for Bitcoin?
It's a great question, and I think that the nature and the openness that represents the internet, and whether that's in cryptocurrency or just the ability to be somewhat anonymous, makes it very hard to attribute attacks to the right places. And that combined with the fact that there are payment models that are untraceable, makes it particularly difficult. I don't see that there's a way around that. If you got rid of cryptocurrency, would ransomware go away? I don't know. We've dealt with offshore accounts and hidden accounts for so long in organized crime that I think there would be another way. But it certainly has added to the speed and the success of the models that we see out there.
So, given the current state of things, what type of things can organizations do to protect themselves against cyber attacks and ransomware, in your view?
Yeah, so everyone's at risk, but I don't think that means we throw our hands up and don't do anything. I think that we have to continue to be diligent in a lot of different ways. And I think a lot of it starts with having a very solid understanding of what's going on in the industry and then communicating that to our end users. We see that we have sophisticated anti-malware software and we have patches that are fairly available. So if you have your malware software in place and you're patching frequently and in a diligent way, you're doing a lot of what can be done. But the other important factor is that now we see socialized attacks around responding to emails and phishing and deceiving workers in the workplace. So having a solid education platform and even tabletop exercises and mock fishing expeditions so that we can see who's out there and just simply reinforcing that model all the time. Never take for face value what you see as an email. It may not be coming from the person you think it's coming from. It may certainly not be representing what's being asked for. And we find that there's dual ways of verifying. We see two-form authentication now, and we see other ways of validating requests that might come across email. So I think that the diligence we can do is be very aware of what's going on out there. It seems like every time we fix one hole, another one springs open. So we have to keep a finger on the pulse and really have a very focused program on awareness and education for the entire workforce.
Yeah, that's a great point. We're really diligent about education, educating our end users, within our organization and our partners and our customers. We have a service where we can actually go out and send sort of mock emails out. To your point, having mock exercises, we'll send mock emails out to our users, and then if somebody responds to them in a way that they shouldn't respond, because some of these emails can be very, very sophisticated and look very, very real to the end users, and it's not putting down anybody. That's not saying that people are doing things that are wrong. It's just that the sophistication, the level of sophistication of the folks that are out there who are trying to get you to give up your personal information is extremely high. And as sophisticated as they get, we and the end users have more diligent in what their behaviors are and how they respond to things. So we as Comport will send out mock emails and we'll do mock exercises for end users and our customers to see who's responding to those emails, who's doing things that maybe they shouldn't be doing, and then educating them, not chastising people and not acting in a negative way, but really trying to educate our users and make them better equipped to deal with these things. And I think that's one of the big keys to what you just talked about.
You're right, Eric, and I think having partnerships and other organizations that can help reinforce and back up and keep their finger on the pulse. I mean, most of my work is in healthcare, and I know you guys work in that space a lot as well. Healthcare was completely focused on COVID this past year. So when attacks started to come up around encouraging people to get vaccinations and sign up for vaccinations, which were really phishing attacks, we needed to help notify hospitals because they were knee deep in not only treating COVID patients, but testing and contact tracing and vaccinations. So it's important, just the same way that we used to have antivirus partners that could always kind of stay one step ahead of the antivirus, development that needed to happen. I think it's important to have folks who are focused on security. You have your own internal security team, that's important, but having multiple, partners out there to help with the effort is crucial as well.
And a lot of times having just a partner who's going to look at things from an independent lens is extremely helpful to organizations as well. Because I think that a lot of people believe that they're doing a good job, and maybe they are, and maybe there's some areas that they can improve. So again, having an independent lens is always a good thing.
Yeah, one of the things we've seen is that, customers think that they've got their backup solution intact, and they do, right? I mean,
Yeah.
they have complex systems out there that are backing up their systems. They can restore, they test that. But one of the issues with ransomware and some of the more recent cyber attacks is the breadth at which they hit you. All of a sudden, you've got 50 systems that need to be restored simultaneously. And have you thought about the bandwidth needs to be able to do those restores? And also the sequencing. Sometimes systems can get out of sync if they're not up to date in real time. So, what's the impact of restoring one server on Thursday and not getting to the other server until Saturday because of the huge challenge in having to restore so much? So, it's kind of making us relook at some of the basic foundational protection systems we've had in place in new ways.
Yeah, that's a good point. And I think a lot of times organizations don't see backups and restores as part of their security strategy, right? But it definitely is, particularly around ransomware today. And what I see is organizations backing things up, but sometimes not being as diligent in testing restores and figuring all those things out. Like you just said, how long is it actually going to take to restore 20, 100 systems if that's what it really takes in order to get back to a solid state? Is that something that you're seeing as well, and something that needs to be addressed by healthcare?
Yeah, absolutely. It just is. It almost makes the restore as much as a silver bullet as that was initially looked at in ransomware. You know, if you could just restore to a point before the infection, then you'd be in good shape. But that restoration process really needs to be understood at such a huge volume, given how much data we have in all systems now. So restoring literally terabytes over the course of a week-long process, and the sequencing of that becomes critical.
Yeah.
So yeah, the challenges and the levels of protection that we've had in the past are being relooked at in new ways because we're really getting attacks that are much broader than we've seen in the past.
And one of the other things that I see, particularly around backups and restores, is there's this concept of having an air gap copy of the data with something that's not really necessarily connected to you or directly connected to your network. And it's a big topic of conversation right now. It's something that Comport can help with because we can provide offsite long-term archive of data, or even a short-term retention of data, in our cloud, or even with one of the big public cloud providers. So, having that copy that is difficult to get to or impossible for ransomware to get to is extremely important right now.
Yeah, you're right. There's two things that come to mind when we talk about that, right? One is the frequency of doing backups and the realization that malware that causes ransomware is typically on your network for weeks, if not months. I think the average was 90 days or something. So you think about everything you've been backing up for the past 90 days, and potentially you're backing up those triggers that are going to cause the ransomware to occur. So that can be an issue if you are not, taking a look at what you're backing up. And the other one, as you mentioned, is online backups, right? If you get hit and a virus or a malware or ransomware is propagating across the network, and it can traverse an online backup and start infecting your backup or encrypting your backup files, then they become useless as well. So
Yeah.
a lot of things to think about there.
And that's generally the first thing that these sophisticated attackers go after, is they go after backups and they go after snapshots. It's really amazing the level of sophistication that's been happening in the industry right now.
Well, it
Um,
is, and we see, cyber experts are being recruited, as if these are Fortune 500 companies, because it is such big business, it is so profitable, and there are financial incentives to get very talented individuals to, figure out where the holes in their business model are and plug them. We're constantly reacting. So we think backups are the solution. They go after the backups. So it's always a constant struggle between how they're modifying their attacks and how we're trying to protect against them.
yeah. The numbers are staggering. I was reading the statistics the other day. As you said, 90 days is generally the amount of time that an attacker is inside of the network or the environment before somebody realizes that there's something going on. The other number I thought was astounding was 280 days is the amount of time from when an attack starts or the attacker gets into your environment to the time it's completely remediated and it's removed from the environment. 280 days. And that equates to about, on average, about $4 million that it costs an organization for a cyber attack. And healthcare is the highest, it has the highest dollar amount associated with that. So that's the average. But if you look at the average, there's some organizations that are higher, some organizations that are lower, and healthcare tends to be on the higher end of that. Talk about some of the things that go into that number of 4 million around loss of business and things like that.
Sure. The financial picture is very scary. I just read the global impact of ransomware in 2020 was over $1 trillion. Those are incredible numbers. And that doesn't even account for the amount of money we have to spend on protection and staff and cyber liability insurance. So we have all of these additional costs hitting the healthcare system and ultimately getting passed down to patients. And in an environment where healthcare costs too much and we need to improve and make it more efficient, we have these other challenges, and every industry does too. So the numbers are staggering, and we see from lack of elective surgeries that need to be canceled in healthcare, just diverting patients elsewhere until the systems are restored again. And the dollars are huge, but the patient safety issues are critical as well. We've become so dependent on IT in healthcare, and in a good way, right? We want to be able to enjoy the efficiencies that represents. But it's not like the old days when it was very easy to go to downtime procedures and then catch up after the fact. So we kind of have a risk going up and dependency going up simultaneously, which makes it especially difficult and expensive. The other interesting thing is that as new nurses are coming up and new doctors are coming out of med school, they don't remember a time when we charted on paper. So just kind of going back to the paper chart as your downtime procedure is starting to get a little sticky because you have to re-educate what it is to chart in a paper chart anymore, and really how much time and effort do you want to spend on that. So really difficult time. I think some of the reasons, and you mentioned healthcare as a target. HHS just came out with a pretty good document on the current state of cybersecurity, and they reference the fact that 60% of all ransomware attacks in the U.S. are in the healthcare field, which is interesting because healthcare doesn't necessarily have the deepest pockets when it comes to payouts compared to the financial industry and other places. But healthcare also struggles with the amount of reinvestment back into IT and IT security. And you and I have talked about that for years. And not that anybody's doing anything wrong, but for a hospital, it's got to make decisions about upgrading their infrastructure, upgrading all of their medical technology, keeping their physicians salaries in a way that they need to be. There's just a lot of competing priorities, and the reinvestment into cybersecurity hasn't always been as much as other industries. I think that's one of the reasons to be as efficient with that investment as well. And again, the need for knowledgeable and good partners in that.
Yeah, and I think it seems that the ransomware attackers are going after these organizations that they feel are going to pay them the ransom, but I think there's also calculus in there that healthcare has cyber insurance, and that the cyber insurance is going to cover everything, and that maybe it's easy for healthcare or any organization to just pay the ransom, get back up and running quickly, and then deal with the aftermath afterwards. I think that seems to be the trend, and I think that there's obviously some repercussions of that, or maybe even sometimes that's not possible. Maybe if you could talk about that a little bit as far as the cyber insurance is concerned.
Well, yeah, I think you're right, Erik. One of the things that makes healthcare a target that will likely result in the payment of ransom is the criticality of the information, and also the secure and privacy nature of the information. So the threat's not always just about encrypting your data and not giving it back to you. The threat is often about, we're going to post it on public websites and bring all of this to light. Nobody wants their patient information to be splattered all over the dark web. So that's a key threat as well. So I think it's nice to think that we just never pay ransom, and that helps curtail the number of attacks. But the reality is that times get pretty desperate when your priorities are around patient safety, privacy and confidentiality, and getting back to business. When you have an issue like this, so it's unfortunate, but I think we're kind of leaning toward, let's get back up and running, and if that means paying the ransom, so be it. The cyber liability issue, every organization now has cyber liability insurance policies, and I think the mindset was, and some of the policies actually have terms that cover a certain amount of ransom within those policies. So that does help solve the problem in one degree and helps perpetuate the problem in another side, because, as you said, the realization is that now somebody's got the money out there, waiting already. So let's go get it.
Yeah, and I'll go back to, that's a great point. And I'll go back to the detection phase and also investment into cybersecurity for IT organizations. And so that it tends to be a little bit on the lagging side of things. But one of the areas where I've seen some organizations lead in this area is that they believe there's this concept of zero trust right now out there, where nobody trusts anything, right? So people aren't trusted, devices aren't trusted, networks aren't trusted. So verification everywhere is a big topic. And so that's one thing that I see organizations really spending a lot of time, money, and investment in. And the other thing is detection, alerting, monitoring, sort of the AI ops aspect of it. We work with several organizations like Palo Alto and Darktrace that will monitor your environment and then alert on when there's an anomaly going on inside the environment. And that anomaly may not necessarily be ransomware attack or a cyber attack, but it's able to detect those things, and then organizations can decide what they want to do once something anomalous is detected really, really, really quickly, rather than having somebody inside their environment for 90 days. So those are the two things that I see that are sort of big trends right now in cybersecurity.
Yeah, I think you're right, and I think early detection is always the name of the game, right? And you don't want to start looking for what went wrong, after the fact. So how do you preemptively go and look? And I think you're right, looking for anomalies, right? In the past, we always kind of focused on unsuccessful login attempts, right? They're going to happen. Somebody's going to make a mistake, and you probably can come up with a pretty normal flow of that. You may see, a couple of dozen unsuccessful login attempts over the course of a day in your environment. When you see several hundred, that's where you really want to focus, and what's connected to you and what that looks like. So you really, really need to look for things that are coming in. And now, if you can identify any traffic that's coming in from offshore, depending on the nature of your organization, maybe you do very little international business, and you can really focus on that as a way to, try to shut that down as much as possible. You just constantly need to be out ahead of this. And I think your point is very critical, right? When you can understand what is quote unquote normal on your network, and then start to focus on the anomalies, that may give you detection that something is askew, early on, and you can react to it and do something. All of the kind of recovery, what do you do when you're hit with ransomware, really focuses on isolating, what's wrong in your environment, getting it offline, and mitigating the spread as much as possible. Early detection, just like in healthcare or medically, right? Early detection helps with the outcomes quite a bit. We also want to do that with cyber events.
Sure. And I posted something the other day on Twitter. I was reading an article that these attackers are using AI in order to generate these attacks and attack organizations in very sophisticated ways. And so what healthcare has to do in order to meet that challenge is to use AI to thwart those attacks or detect those attacks quickly. Because, to your point, if it's a couple login attempts a day, or even a couple hundred, maybe it's a real thing, maybe it's not a real thing, maybe it's a problem, maybe it's not a problem. But when you have, tens of thousands of users, and this is going on across the organization, it's extremely difficult to track these things, to monitor them, to alert them. So you have to use some artificial intelligence in order to detect these things, because it's just not practical for human beings to be looking at screens trying to figure out what patterns are going on and things like that. So that's another area of investment, again, in the AI ops world, as far as security is concerned, that organizations really need to pick up on and really need to invest in.
Great point. We have a huge need for that in healthcare, and not only in the cyber, security realm, but in terms of finding better treatment models, better efficiencies for care. AI and big data are untapped resources. Healthcare always tends to be a few years behind, but there's a realization there. It kind of sets up a little bit of a paradox in healthcare. And I mentioned I've been doing a lot of work in the interoperability space. There's a big push now to get more information into the patient hands. Let's make healthcare more patient-centric. Let's give you access to all your health records, which is great. We all enjoy kind of the modern internet model where everybody has immediate access to everything, which is where we need to be. But that comes with additional risks, right? Sharing that information, and yet, to your point earlier, the hesitancy to share information sets up this paradox where we know that there's a lot of things that make sense in healthcare, but we have to take more deliberate steps around it. And I think that's where we want to make sure we have good, solid arrangements set up so that we can do everything from baseline your operations, understand what goes on normally, and then how do we look for those anomalies, and how do we use AI to do that? Because you're getting millions of data points from across your network management system, and having anybody kind of eyeball those is not going to be a practical solution.
Yeah, absolutely. The one last thing I just want to cover is that just about every organization these days is being taxed with having to provide higher levels of service, whether that's in infrastructure and networking and security. Nobody can do everything, right? So one of the things that Comport can help is we can either take over as a managed service part of the network, the VMware environment, or part of your security network, your security apparatus. And we can really augment what these organizations are doing, and what they're able to do from a project perspective, a deployment perspective, or from an operational perspective. So I see that a lot, particularly in healthcare, that they're not getting any additional help. They're not getting a lot of new headcount, and they're being asked to do tremendously more, probably, than other organizations with the same amount of resources. Are you seeing that as well?
Yeah, absolutely. We touched on it a little bit, but the impact of the pandemic in healthcare has been tremendous. I mean, basically, starting in first quarter of 2020, almost everything was put on hold unless it was absolutely necessary because of the obvious need to focus on other priorities. And over the course of that time, it's just been a grueling experience in terms of the amount of hours required and the amount of work, and then people's stresses about working from home and getting their kids through school. So this has had an impact on the workforce across the board, right? And we're kind of seeing that now. It's very difficult to find IT resources. Some people just left the marketplace altogether. So it's for a lot of reasons. And I think as the dust settles, hopefully post-pandemic, we see what those new models are going to look like. And I think that there is going to be a drive toward a lot of as a service types of things. And I think when you can maybe make that part of your cybersecurity plan, and it's not a one push the button and you're done. But it becomes a mix of what makes sense for you to have in-house versus what you can find and training people, and what you can outsource, and again, those solid trusted partnerships that are going to help you through your issues are invaluable.
Right. Well, Jim, we covered a lot today. I appreciate you joining us. Thank you very much. Your insight, as always, is greatly appreciated. If anybody has any questions about anything that we discussed, comport.com, you can go there. You can look at us on Twitter, LinkedIn, all of our social media outlets. So thank you, everybody, again. We appreciate it.
Thanks, Erik. Great talking to you again.
Thanks, Jim.